This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, we're talking about receding gums. They can be really bad news. For one thing, they look terrible, but they can also cause sensitivity to cold. But worst of all, did you know you could lose your teeth if you have bad gums? Well, joining me now is Dr. John Chao. Dr. Chao, thanks so much for coming and appreciate it.
It's such a pleasure to be here, Dr. Steve.
So let's talk about receding gums. Why does that happen to people?
It basically happens as a result of overbrushing and having gum disease that has not been properly treated.
So if people brush really, really hard, they can cause their gums to recede, which is a mistake, obviously.
Yes, and it happens to people sometimes who are overzealous.
Right, overzealous brushers, right.
Yeah.
So what happens if you ignore the receding gum line? What can happen if you just leave it alone?
You leave it alone, it can progress more and more to the point where you've lost so much gum and bone that you can actually lose your tooth. Plus, the exposed root surfaces can actually decay. And so that can lead to serious problems, such as root canals and so on.
Root canals. Okay. So traditional treatment of receding gums is what?
A traditional way of treating this kind of gum problem, the receding gum problem, is for the dentist to actually cut a piece of gum from the roof of the mouth.
Wow.
And then grafting it to where it's needed by stitching that piece of gum to the gum around that tooth.
Wow, it sounds painful and it sounds like it's kind of tedious. You do one tooth at a time, or is it you do a whole part of the mouth?
Generally, you do 1 or 2 teeth at a time. The average is 1 or 2 teeth.
And the recovery?
The recovery could be 1, 2, or 3 weeks.
Wow.
Some discomfort in terms of the symptoms, the bleeding, the swelling.
I can imagine. Okay, so you're basically cutting one section of gum away and you're putting it in another spot. You've pioneered a new procedure that's minimally invasive. Tell me about that, because that's something special.
Okay, it's called the Pinhole gum rejuvenation procedure, where we actually don't need to do any cutting at all, anywhere. And we don't need to do any stitching anywhere. So this is the good news, because a lot of people are very afraid of dentistry to begin with, and this really, really takes the fear out of it. This is done by a little pinhole that I make, and through this pinhole above the tooth, then I use special instruments that I've invented and patented to move the gums to where it belongs in a very, very short time, so that the patient can look at it, very quickly after it's done, that it's become normal.
Right. Now, do you do one tooth at a time, or you do a whole section? Can you do that?
Well, the good news is that we could do many teeth at one time.
Wow.
I can do up to 10 teeth within an hour.
Wow.
And it's as if the gums have grown back to where they belong within that time.
Fantastic. Now, what's the recovery time on something like this?
Recovery time is almost nothing. The same evening, they can have their dinner. It's very, very minimal, because we're not doing any cutting. We're not traumatizing the tissue.
Wow, it sounds revolutionary. Here's the thing, though. There probably aren't a lot of doctors that do this. So are you training other doctors on this technique?
Yes, I'm very committed to training as many doctors. We've trained some already. I want to train as many doctors as I can across the country. In fact, from Europe and other countries too, they're coming to get trained so that people can benefit from this new way of treating this very perennial problem. It's very widespread.
Right, huge problem. So how would someone find a doctor that does this kind of procedure? Obviously, they could find you.
Yes, if they can call me or contact me through my website, which is pinholegumrejuvenation.com.
Okay.
And then they will be able to contact my office, and I'll do whatever I can to help those callers, and people will contact me, including directing them to the doctors that I have trained.
Perfect. So last question was that everybody wants to know is, how much does it cost, and is it covered by insurance?
Okay. It's the cost varies from different parts of the country to another, but it's comparable to what the patients have to pay for the grafting technique.
Okay.
Except that because we can do so many at one time, actually the per tooth cost is much less than we did 1 or 2 teeth at a time.
Right. And will insurance cover this?
Insurance have covered some of it.
Right.
And I think they will probably cover more and more of it as more and more people get it done and they want it. And so the insurance companies, I believe, will respond to the demand.
Yeah, because they're kind of behind on this because it's so new. Dr. Chao, thanks so much for coming in. Really appreciate it. It sounds like an amazing, amazing procedure.
It's my pleasure, Dr. Steve.